One of the most powerful vehicles to save money just got even more powerful. Unfortunately, many Americans don't really know what these accounts actually do, how they work, and are often these accounts are quite misunderstood to many people. What we're talking about, of course, is a health savings account. There's a lot of money in them already. About $112 billion of American hard-earned cash is sitting in them. So that probably seems like a big number, but that's the total balance that is in them. Across this country, Americans spend $400 out of pocket, $400 billion every year on healthcare expenses, on out-of-pocket healthcare expenses. So understand those numbers a little bit more. So you got $112 billion that's sitting in basically 37 million HSA health savings accounts across this country. But then every year we're spending $400 billion on those out-of-pockets expenses. So there's clearly an underutilization of health savings accounts across this country because most people don't quite understand or don't realize the features or don't miss out sort of on the opportunity. So in this segment of the program, we're going to talk more about, we'll talk about what they are and how they work and understand how they have become even more powerful than what they were. So welcome on into the program. This, of course, is Dollars and Cents, where we help you make sense out of all of life's decisions involving your dollars. One of Central Florida's longest running radio programs, also a top 25 financial planning podcast on the big wide world web. My name is Joel Garris. I'm a certified financial planner, certified financial fiduciary at Nelson Financial Planning, where we help hard-working folks to do good things with their money. So if you're in need of help, go to our website, Nelson Financial Planning, fill out the Contact Us box, and let us know how we can help you. So health savings accounts. Here's sort of the big headlines, and it's really one of those more overlooked or misunderstood type of accounts. And so we want to start by first sort of explaining kind of what it is. And one of the reasons why a health savings account is as powerful as it is, it literally has a triple threat, if you will, of tax savings. So when you put the money in, you get a tax deduction for it. That's number one. Along the way, if you're not using the account, it grows on a tax-free basis. That's number two. And then lastly, when you use the money in that account for medical expenses, then all of those withdrawals, if they're used for qualified eligible healthcare expenses, are tax-free. That's number three. So there's your triple threat that the health savings account ultimately represents. Eligible medical expenses can be anything from your Medicare Part B premiums to your deductibles, your copays, your vision, your dental, your hearing, even long-term care. So the one caveat that you need to know if you want to set up a health savings account is that you must have a high deductible health insurance plan that allows you to have the eligibility for the health savings account, right? So you can't have an HSA with just any type of health insurance plan. It has to be specifically an eligible high deductible health insurance plan. So the reality is, though, that they are so powerful that we're seeing more and more employers kind of adopt these eligible high deductible insurance plans that give people an opportunity to have a health savings account. Because if you stop and think about sort of the tax benefits that come with an HSA, it's basically like walking around with a 22% off coupon in your pocket every time you go to the dentist or the eye doctor or go for hearing or any out-of-pocket medical expenses, because if you're in the 22% tax bracket, right, and you get the tax deduction, then that's 22% off. So it really is like you're walking around with like a 22% off kind of coupon. Now, HSAs also have some great options in terms of being able to either use it immediately for expenses. So you put the money in, and then let's say the next month you're going to the dentist, and you turn around and take the money right back out. Fantastic. You still wound up ahead by 22%, assuming that that is your tax bracket. Now, if you don't have to use all of that money, then you can actually invest it. And usually within HSAs, there'll be different types of investment options that you can do inside of that HSA. And that, I guess, is the big difference. And I guess where the big confusion comes into play is that most people think, oh, I got to use it or I lose it, because there's other types of plans, usually flex plans or things like that, where you have to use it by the end of the year or else you lose that money. But HSAs, see, the flex plans have been around much longer than the HSAs, and everybody kind of thinks that the HSAs operate the same as the flex plans, but they really don't. The flex plans, you got to use it or you lose it. HSAs, though, very, very different. If you don't use it, you can continue to carry it forward to future years and ultimately have that excess balance be invested to grow, and even when you get to retirement, to use it for retirement as well. So that's the background on HSAs. What's the big news that has made those more powerful than ever before? Well, the big news actually comes courtesy of the IRS. Who knew that they were going to have good news for the taxpayer? But they do, in the form of much higher contribution limits that just got announced for the year 2024. So for 2024, so not 2023, 2024, the maximum HSA contribution is going to be $8,300 for a family, $4,150 for an individual. This year's numbers are for a family, $7,750 and $3,850 for an individual. So a nice little bump from this year to next year in terms of how much you can fund. Remember, that's all tax deductible. Now, if you're over age 55, you also get to put in an extra $1,000 per person. So for a couple over age 55, you could literally put in $10,300 into an HSA in based upon next year's contribution level. So very powerful vehicle that ultimately really is like you walking around with a 22% off coupon when it comes to your out-of-pocket expenses. And certainly when you think about those numbers, there's really not there's an underutilization, right? If Americans are spending $400 billion a year on out-of-pocket medical expenses each and every year, and there's only $112 billion in HSAs to begin with, then it would seem to me then that's clearly underutilization. So, but let's come back to the caveat, and this is really what you need to know. So this is the key piece. Remember, in order to have a health savings account, you need to have an eligible high deductible health insurance plan, right? So obviously for most people, they get their health insurance through their employer. Here's sort of the to-do list, if you will. Ask your employer, or whoever you have your health insurance with, if you're self-purchasing it, ask your provider if they offer an option for that high deductible health insurance policy. Because if they do, then that's how you can get an HSA. And that's the only way you can get an HSA. So in order to get the triple threat tax savings that comes with an HSA, in order to have that account be, that money in that account be continuing to provide you with money even in retirement, then you need to have that high deductible plan. So make sure you take the time, particularly if you're coming up on sort of selecting the benefits, things like that, to really ask those questions about what the options are with your health insurance. Because if there's a high deductible insurance plan, you really want to take a look at that in order to be able to have those health savings accounts, which are really pretty powerful. With that, we will take a break and continue here on Dollars and Cents with Joel Garris of Nelson Financial Planning.